Welcome everyone to the Starting Point Education Channel podcast. My name is Loretta Depka and I'm thrilled to have Pat Obst here tonight to help us talk about doing grief well. We are going to discuss loss due to life-altering illness or injury. You can find many other podcasts from Pat on doing grief well on our education channel that you can either access through startingpoint.org or just go to our YouTube education channel. Okay, so Pat, why don't we get started? You have been at Starting Point since you were an intern, correct?
Yes, 20
and you
some years ago.
specialize in grief and loss, specifically in the past few years, focusing mostly on parents who have lost children. Do you want to talk about how you got there before we get started here? I think it's an interesting lead off to this conversation.
Sure. Well, when I had lost my son, Ricky, it'll be 20 years this June. That's when I kind of made this switch with my practice to become a grief counselor as part of his legacy. And he's my sidekick every day in what I do. And in fact, I don't remember, Loretta, either May or June, we're going to actually have a special, maybe a couple podcasts related specifically to the grief of losing a child. And that's kind of in honor of Ricky because he died in June. I went into the hospital with him prematurely in May, and then in June is when he was born and died. So, I want to do that as to honor him then, and of course to support all the parents that I work with. So just whoever's listening, pass that along to any people that you know in that position, and keep an eye out on the Starting Point website because that'll be announced, right?
Absolutely. We are going to have to publicize that a little different, but I want to make sure that everybody can join us live on that podcast. I think it would be really beneficial.
Right.
All right. So tonight we're going to talk about loss due to life-altering illness or injury. There's something on your website, Pat, that I find really just something to think about is our identities are closely tied to our bodies and our ability to experience life as we know it. That really struck me the first time I read it, and rereading it tonight, I was thinking, wow, that really says it all, doesn't it?
Well, I just real quick, there's a question that it can be asked of people. If you said to them, if you only had one car that you could drive your whole life, just one car, your absolute favorite, what would it be? And then of course they say, whatever, Lamborghini, whatever. And then you say, well, how would you treat that car? Oh, yeah, I'd wash it every week. And well, this is our vehicle. Our body is our vehicle. How are you going to treat it? So yes, we are intricately connected with our body. So it does affect our emotions as well as, us physically. And that's why it's important for us to understand that connection and how we can grieve with our bodies as well.
And that paragraph continues on your website that says whether you have experienced a gradual loss of health or a sudden illness or injury, a serious diagnosis can create feelings of helplessness, disappointment, confusion, and devastation. That to me says it all. You get a diagnosis and life changes as we know it.
Absolutely.
In some ways, this type of loss is a combination of loss of a loved one and a breakup due to betrayal. You may not feel like yourself. You may mourn what you used to be. It is important that you see this as a true loss and give yourself the time and space to grieve.
Yeah, because sometimes when we have that illness or injury, we actually feel like our body has betrayed us.
So most people don't understand, right, that illness and injury can create loss and grief for all emotions.
I think part of it is not only are we losing um, our good health sometimes, or we're losing the ability to use a certain part of our body, if it's an injury, let's say. But other things that we can grieve and lose are our identity. I had a client years ago, a male who was around 50, and he had a knee injury, and he'd always been an athlete. And he had a knee injury that actually sent him into a depression, because that was part of his identity of being able to be active and being athletic. So sometimes that can really be part of what we're losing. For me, when I went through breast cancer and I had to decide, whether or not I was going to have bilateral mastectomies or get just radiation and chemotherapy and that sort of thing. What was I going to have reconstructive surgery? I was actually at the doctor's office, and there was a woman who was making copies, and I could see her from the side. And in that moment, I thought to myself, I think I want the implants because I want my body to look like a female's body in clothing. Because that identity as a female for me was important. And that was partly how I made my decision. And so that identity is so important in realizing with illness and injury that can be part of what we lose, sometimes the major part that we lose.
Sure. That makes perfect sense. How does somebody actually grieve the loss of their health or physical abilities? Is that different than grieving deaths, or where are the similarities?
Well, sometimes there has to be the idea of acceptance. I think we may fight against a little bit more, because, when somebody dies, they die. Their body is not here. Where if you have an illness or an injury, you want to keep seeing doctors to get better, right? You want to try to fight against it and change it and fix it. And so in that way, it can be different. But then there, of course, sometimes comes a point where, and this is really kind of what we're talking about here, where a certain level of acceptance has to kick in. And we'll really look at that in the next question. But acknowledging what's been lost. The book Tuesdays with Maury, where it's a journalist who interviews, I think it was one of his professors.
One of my favorite books.
Who had ALS, I believe, right? And one of the questions that are asked of him is, how do you deal with the loss? Because you kind of gradually lose the functioning of your body with ALS. And, I thought it was so profound. And what he said was that, he would grieve each part, like he would be with it, and he would grieve it, the loss of it, but also be thankful for what that part of his body was able to do for so long. Kind of just process with it, and reflect and that sort of thing. And then the acceptance came, and then he looked at, well, what can I still do? What parts of my body are still working? So, acknowledging what's been lost. I think the grieving part, a lot of times we're so fighting against, like I said, I don't want this illness, or I don't want this injury, or there's got to be some cure out there, that sort of thing. There's a time for that. But then there's a time where we say, okay, this is what it is. And we have to acknowledge then what has been lost. And that's the grieving part. We already talked about identity. We have to be vulnerable with ourselves about what we're feeling. We can't just tough it out anymore, right? You can't just keep running if your knee is just, has exploded and you can't run anymore. I think we need to allow ourselves to be angry at the unfairness And there's some of that, betrayal of our body, that we have to allow for that anger. We have to allow for the fear of not knowing what the future holds, right? Not knowing, am I going to need more, surgeries? Am I going to be able to pick up my grandchildren? If you have, let's say, back issues. And we have to acknowledge that frustration, frustration with the doctors, frustration with pain, frustration that we can't, that maybe we move slower, right? We can't get as much done. So part of the grieving is feeling all, feelings won't kill us. And a lot of times people don't want to do the grief part because they're afraid of those feelings. But when we allow ourselves to process through them, we're actually better off. And so I'd encourage people not to be afraid of all that.
I'm thinking about what you said for an athlete. One of the things athletes learn, and maybe it's a little different today, I might be dating myself, but in the old days when I played sports, we just walked it off.
Right.
And usually that guaranteed us the evening in the emergency room, or, 6 weeks on crutches. I think I spent probably half my life on crutches. But how do we, the whole thing about positive thinking and walk it off and all those terrible things that we're hearing constantly about what we should do. Right. What I'm hearing you say is we've got to give ourselves permission to.
Yes.
And that's really an important piece.
Well, and so often if we skip the grieving part, the healing and the recreating our lives can't happen. So, but with illness or injury, there's a step even before the grieving. We might grieve a little bit that we got an injury or whatever, but we don't, that step before is we try to fix it.
Right. That's it.
We see a million doctors, we, get surgery after surgery or whatever it is. Right. And that's important that we do that. That's an important step, because we have to feel like we've done as much as possible to kind of get back to normal. Right. Absolutely. But there comes a point where we have to say, this is as good as it's going to get. And we can't just bypass that, because what comes then is, oh my God, this is as good as it gets. I won't be able to do this, that, and the other thing at all, or the same way I used to. There comes the grief. Allowing yourself to be sad, allowing yourself to sit around, allowing yourself to isolate for a little bit, for a time. And then we move to the healing. So it is important for us, once we've tried everything there is out there with the doctors and whatnot, to be sad, to be upset, to be frustrated, to be fearful, to be angry, and then move from there.
And how do we move to that healing process?
That's where the acceptance comes in. And, synonyms of the word acceptance, I'm a great believer in the thesaurus, because words have meaning. Synonyms for acceptance are cooperation and acknowledgement. So acceptance is acknowledging, this is it. This is the body that I have to deal with. Now, how am I going to cooperate with it? Because if we're too stuck, if we haven't allowed ourselves to grieve and be mad at our bodies and all that, or mad at whoever caused our body, an car accident, maybe, whatever, we can't come to this place. So cooperation and acknowledgement is like the sailboat, right? The wind is coming straight at you. You can't move forward if you're just going to sail straight. It's not going to happen. You have to tack. You have to work with the wind, right? Even though the wind is against you, if you tack right with a sailboat, if you go left, right, you can get to your destination, right? So it's that cooperation with the elements as they are. So it's that cooperation with our body as it is. So this means that we have to stop with the this shouldn't be. This isn't fair. We have to stop looking backwards. It means working.
If we grieved properly, we can skip that part, or does it, even if you think that you grieve through the process where you are angry, does it, do you just stay moving forward, or sometimes do you go back and forth, I guess is what I'm after.
There's always going to be moments of the grieving process, the grieving, healing, recreating our lives is always going on, all three. It's just it's heavier in some areas at times than others. Like earlier on, you're going to be heavier on the grieving side. Later on, you're going to be heavier on the recreating your life after loss side. But that doesn't mean you don't dip into, right? Like for instance, how many years after, I guess it was about 7 years after the breast cancer, I got lymphedema in my left arm because I had poison ivy, and then I have lymphedema. So you dip into, okay, now I'm going to have to wear this goofy sleeve. And, so there had to be kind of a grieving that my body is always going to have some sort of residual in regard to the breast cancer.
Something that you want to try to forget.
Right. And kind of being sad that, oh, darn, it's not really gone, right? Completely. And then that acceptance has to come of, well, I've got to cooperate with this, right? I've got to go see the physical therapist. I've got to wear the sleeve, that kind of thing. I'm not allowed to weed the garden anymore because there might be poison ivy in there and I can't get poison ivy.
Oh, that's a good excuse. I like that.
Yeah, exactly. So it means working with the situation as it is. And even if it means using some equipment, I worked with the elderly through Cadbury and Cherry Hill. And sometimes people would fight me on using things like their walkers or their canes or whatever, because they felt like it was, they just wanted to be independent, right? And what I tried to help them understand is that using the equipment actually maintained and elongated their independence, because it would keep them from falling, which would really wipe out their independence. And so that's part of the acceptance is, okay, what kind of equipment? Well, okay, I got to wear a sleeve. What kind of equipment do I need to use? I need to wear a compression sleeve on my arm now. And making friends with that, right? So I got them from a place called Lymphedema.
Really? There's a place called that.
Lymphedema. And they have these cool sleeves that are all like flowers and butterflies and that sort of thing. The other is acknowledging the abilities that you still have, right? That's part of the acceptance is, wait a minute, there's other parts of my body that work, or I can still do things even though I'm in pain. Like I'm capable of doing things. Okay, I have pain, in the back of my mind, I know I'm in pain, but I can still do things. Stephen Hawking is, what did he do? It was his mind. He just, in the end, that was all that kept working was his mind, right?
Absolutely.
So look how brilliantly he used it. So that willingness to begin to look forward, the Special Olympics people, right? They accept, I only have one arm. So they figure out, how am I going to balance on the snowboard with an out of balance body? So they figure that out. So they begin to cooperate with their body and not hate it. That's a really important part of acceptance. If we hate our bodies, we're not going to treat them very well. That's part of the reason why we need to grieve and then accept, so that we can eventually love our bodies as they are.
Huh. So then, okay, so now how do you, and I mean, chronic pain is part of this, right? So how can somebody exist in chronic pain and still find joy in life?
So chronic pain, of course, can be, physical, and it can be emotional. We can have chronic emotional pain. We can have chronic physical pain, and both, right? To give you an example of chronic emotional pain, when I lost Ricky, one of my mantras was, if I can't be happy, I may as well be useful. Because I knew as a therapist, I was going to be in extreme chronic pain for about 2 years. And so I painted my whole house. I learned to cook Italian food. There's things that I did because I could cry while I was painting, or I could cry in the corner in my room. So I kind of took the pain with me. And it's the same thing with the physical pain. Now, granted, there are times when we are just laid out, right? We cannot move. We have a migraine.
Times, right?
Right. I mean, some people with migraines and whatnot, that they can't. But again, when you learn to cooperate, when you accept and you cooperate, you learn to work with the ebb and the flow of the pain. Right. I have a client who he just severe back and neck issues, lots of pins and plates and screws and surgeries. And he's done yoga that has taught him to, when he has spasms and that kind of thing that go along with it, that he's learned how to breathe and be with the pain, almost be one with the pain, in order to feel it and then kind of release it. So, yoga is one of those things that some people use in order to work through those, because a lot of times chronic pain spikes. It's not just a chronic ache. A lot of times there's these spikes. Finding connection. This particular person also, he found connection with other people. He takes his dog to the dog park. So he's still trying to engage in life, even though he's in chronic pain, and he's made friends with people at the dog park. And the dog is his service dog. I had a client who actually, unfortunately, lost her son to a drug-related death. But when her son, a few years earlier, had been in the hospital with Crohn's, and had the tube down the nose, down the back of the throat, which is very uncomfortable.
Oh, that is hard.
He said, Mom, what, I can't, I got to be distracted. What can I do? So they used to play cards all the time. They played poker, and he was very competitive. So she knew if she could get him to play cards. So he got, right into that competitive spirit playing poker. Was he still very uncomfortable? Yes. But he was able to just, kind of just not necessarily even distract himself as much as his focus on playing poker put the pain in the back seat. Where playing poker and beating his mother was in the front seat. You see, we don't get rid of the pain.
Sense, right.
It's not getting rid of the pain.
Not that the pain went away. It's that he was
put it in the back seat.
Brain didn't have all that room to only have pain there.
Right. I have somebody with COPD and spinal stenosis. So she's in pain whether she sits or stands or walks. Right. But she knows that if she walks, her COPD, her breathing's getting a little better. So even though the walking isn't going to necessarily help her spinal stenosis, it's helping her breathing, right? So it's learning to work with your body rather than either working against it or kind of letting it take over. And so you just lay on the couch, which actually kind of begins to make it worse, right? So that is, how people can deal with, chronic pain with these conditions.
So then how do you take the next step, which to recreate your life with these limitations?
So because again, we can live life with chronic pain, life altering injury, if we allow ourselves to. I remember years ago, I was like 20 years old, was with a friend. We ran into someone at a diner who we knew, and this person had been in a bad motorcycle accident a couple of years before. And we said hello to him. He had a cane. He was a young guy, but boy, was he miserable. He was nasty.
Oh, wow.
And it just, we can stay stuck, right? In that this shouldn't have happened to me. This is terrible. I hate my body. I hate the way I look. I hate the way I feel, right? We can stay stuck in all that. Or we can go through the process that I've just talked about and then figure out how we can live with it, because it's not going away. So I had a client who had really long-term chronic cancer, 19 years with breast cancer, in remission, out of remission, in remission, out of remission. And she actually came to me, not about the cancer. She was in remission. She came to me about her son who was in Iraq. And she was just a nervous wreck that he was overseas, fighting in a war. So that's, a lot of what we were working on. Well, in the process, she unfortunately came out of remission and her cancer came back. And so even though she was in treatment and in a certain amount of pain, we worked through a lot of her issues, lifelong issues, and and some of her losses, her loss history. One of her losses was she felt guilty since she was like 8 years old that she let her dog out and her dog got hit by a car and killed.
Oh.
And so we worked through that, and she came to a place of forgiving herself, and to the point where she was able to have these little trinkets that were of the kind of dog that she had. I think she even got a stuffed animal. So even in the chronic disease, the pain, she was able to come to peace about other things in her life. And so part of the recreating is this thing is not going to be, doesn't have to be all of my life, right? There are other parts of my life that are important too. And other parts of my life that I can still be active in or make progress in or come to peace with, right? Again, focusing on what we still can do and loving our bodies. It's important, I think, even to do that physically, to care for our bodies, get massages, put lotion on, get your nails done and your hair done and those kinds of things that I think that all of us probably have had an aunt or somebody who, has been in a hospital bed but they have their nails done and their hair done because,
right.
because they have that dignity, right? That they, even though their insides are a mess. I have a woman who was in a car accident and her neck is all messed up and she has to get shots and whatnot, but she goes to the gym because she knows she has to try to keep her body strong. She's volunteering. She still goes to her AA meetings. It's that living life with it. The gentleman I talked about who, with all the back issues and neck issues, and who does the yoga, he found some purpose and meaning in his life. He actually has gotten off of a lot of his heavy duty pain medications, and now is an advocate for medical marijuana, responsible use of medical marijuana. It has, like, he's actually present now when I talk to him, where he wasn't before with the prescriptive medications. And so he's doing a lot of advocacy for other patients. So some purpose and meaning has come out of his, this lifelong, injurious condition that he has. I have a gentleman who fell and hit the back of his head and lost all taste and smell, not from COVID, but from hitting his head.
Wow.
And he's found a way to be creative. He likes to cook. And he went through a depression, right? Because he also likes to eat, right? And you can't taste. And but then as he came out of that and accepted, now he eats a lot of salads, and he's creative with the different salads, because salads can have a lot of different texture and crunch. So
that
he
makes perfect sense, right?
Texture and the crunch and the colors. My mother-in-law used to say, you eat with your eyes first.
True.
Right? So that's something that he has done. I have a client who's an artist. She's a potter, and she had a foot injury that basically she can't quite do what she used to be able to do. But because of that, she's actually gone into, another area of pottery that has kind of opened up some creative avenues for her. So sometimes these things can shift our life in a good direction. And then with me, with the breast cancer, one of the ways that, recreating my life after loss, my partner and I went to San Francisco that summer after I had the surgery and then the reconstruction. We both turned 50. It was our 20th anniversary. And I had beat breast cancer. And so we took this trip.
It must have been a wonderful trip.
It was a wonderful trip. But surprisingly enough, after that is when my private practice actually began to really blossom. Whether it was in part because, enough had happened to me at that point that I could really relate to everything that people were going through, or what it was exactly. But, sometimes if we allow it, these either, chronic conditions or something that, happens to just change the trajectory of our life because of an illness or an injury, can open doors and create possibilities if we allow it. I mean, I've heard interviews with people who've become paralyzed, and they've been asked the question, if you could go back in time and not be paralyzed, and I've heard people say, I wouldn't want to do that, because what has opened in my life because of this, I would never want to give that up. And a lot of times we can't do that if we stay in anger, if we stay in constant searching for solutions, when we need to come to that place of acceptance. Then
Pat, in all this conversation, you've never used the word grateful. That's like as close as you come to, somebody being acceptance and being able to turn their life around. But you never used the word grateful. And I just wonder why, because I do think people resent that. Oh, you have a good life now, you should be grateful. You're not using that word at all. And I just find that really interesting.
You mean grateful that they're still alive, or grateful that?
Almost grateful that whatever it is happened to make them redirect their lives, or to make them appreciate a whole nother side that wasn't there before the accident, the disease, the diagnosis.
Well, I think if we're isolating and we're bitter, we're going to hang around with people who can never be grateful for anything, and they especially can't be grateful that, you know, their body has gone through what it's been gone through. It's partly who you hang out with, because there are people who are grateful for what has come out of what has happened to them. And so again, if you're busy being kind of in that staying stuck in that victim mode, you won't even be inspired by those people, right? If you won't turn on the Special Olympics, right? But if you, you know, it's just an openness. It's not that you have to say, oh, you know, I'm grateful this happened. You have to be open to the whole process that, and live into being grateful for it. When you're far enough out and you've been able to recreate your life, you can look back and you can say, wow, the things that I'm experiencing now, I would never have experienced if I didn't go through this. It's more, the gratitude, I think, comes when you're able to look back. You don't have gratitude sometimes when you're in the muck of it, right? Sometimes that's toxic positivity.
That's what
You're not acknowledging that, boy, this is hard, but you just got to be open. Like, let me just keep working it, right? Keep
I love
tacking.
the word open. That's the perfect word.
Yeah. Well, and I think, you know, part of what I say in that you know, to be present with the grief and to be open to healing, right? And then allow yourself to recreate your life. So with the, just to wrap it up, with physical, you know, illness or injury that's life altering, it's perfectly fine for us to go through trying to get better, or, you know, to heal as much as we can, right? To get out of pain and all that. But we have to know when that time comes where we say, this is as good as it gets. And to grieve that, go through that process. That's acknowledging and validating. That's very important. And then be open to that healing. Okay, what can I do with what I still have? Who are the people that can inspire me? And then you find your own way, what works for you, right? And that's where the recreating your life. And then it's not just about what works for you in regard to your injury or illness, but you're busy living life with the chronic pain, with the limp, with, right? And now you know you've recreated your life, bringing that with you, because you can't leave it behind, because you're stuck with it. So that's kind of the process that we have to allow ourselves to go through.
Well, Pat, I found this really helpful. And I hope everyone that's listening is having the same reaction. I can't wait for the next Doing Grief Well podcast that we do. So thank you very much for doing this evening. And we'll be back on probably within the next couple of weeks with a couple more. Thank you for joining us. Thank you for thinking of Starting Point. Have a great evening.
Thank you. Take care.